The air we breathe is colorless and shapeless, so we don't often know what we're breathing. As a result, indoor air quality is something that can easily be taken for granted. Poor indoor air quality, or IAQ for short, can have a big negative impact on your health and the health of members of your community. Now here's the good news. You can play a key role in helping to keep your indoor air clean and improve the overall health of the community. When we speak of indoor air quality, we're talking about how the quality of our air is affected by sources like cooking, cleaning products, wood smoke, mold, pollen, and whatever else is going on outside that makes its way inside. In fact, the concentration of pollutants indoors can be 2 to 5 times higher than what might be going on outside. This also is not great news when you consider that the air is colorless and shapeless, so we don't really know what we're breathing. Now also consider that people who live in the US typically spend 90% of their time indoors. You get the immediacy of the situation, so it's imperative that we educate our communities and teach them all the low-cost and efficient actions that can be taken to improve our indoor air quality. In this video, we'll be covering indoor air quality and its effect on health, how external and internal sources can negatively affect the air inside a home, and steps you can take to improve indoor air quality. Let's get started.
I think of indoor air quality as the quality of the air inside a building, like your home or your school. When I think about the people who are most at risk, it's usually the extremes of age, infants, young children, but then also older adults. And then people who are pregnant tend to be the most susceptible to bad indoor air quality. Primarily people who have underlying health conditions, and I'm thinking mostly respiratory conditions or heart conditions. Those people, when they're exposed to different pollutants, might be at higher risk of having flare-ups from those problems. So they might get hospitalized because of heart or lung disease.
We can get some exposures from lead exposure, faith dander, mold spores. Many everyday things like lighting candles, cleaning chemicals, using wood stoves or gas stoves. They can release chemicals and particles within the air we breathe.
Bad indoor air quality can cause eye irritation, runny nose, or upper airway irritation, sore throat, can cause increased cough. And depending on what it is, some things can cause headache or dizziness or fatigue. Some indoor air pollutants are known to have an effect on mental health. I've seen this with wildfire smoke. There's some studies that have shown that wildfire smoke exposure can actually be associated with depression and anxiety. In some people, they may be at higher risk of having a heart attack or a stroke. Some indoor air pollutants can actually increase your risk of cancer. For example, exposure to radon or asbestos can significantly increase your risk of lung cancer. To help families address bad indoor air quality, I think the first step is trying to figure out what exactly it is, because that's going to determine how you address it. For some kids, it might be allergies, and so they can work with their medical provider to figure out if they do have allergies and what to do about that. And it might be other things, though, unrelated to allergies, like cigarette smoke or cleaning products that are really irritating to the airways. And so paying attention to when those reactions happen, when the child has more symptoms, can really help narrow down what might be the problem. But definitely talking to your healthcare provider could help.
But there's so many different things that can impact the indoor environment with respect to air quality. So really you're looking at the building envelope, the ventilation systems, regulated building materials, chemicals that are brought into the spaces. The way that pollutants work their way indoors could be through gaps in the building, open windows. There might be a ventilation system that's drawing in air from the outdoors on people's clothing. You know, they might have been at work doing some sort of activity that generated dust or other pollutants, and then they bring it home. And then on pets, so if you have pets, they could be rolling around out in the dirt or playing, and then They bring in that dirt on their fur, and then that could get deposited indoors. Since we live here in the Pacific Northwest, we do see more precipitation. Maybe there's a roof that's leaky, or you have drainage issues around the foundation or at the other areas of the house. Then you might see more water getting into the house and then causing damage to the building materials, which would then also subsequently lead to mold growth, which is harmful as well. So people with asthma, allergies, other health conditions could see negative health effects from mold exposure. Also, if you live near industrial sites, the pollution in the air could also make its way into your home. And in the 1900s, there was a huge asbestos boom where hundreds, if not thousands, of products were manufactured with asbestos and used in buildings, in consumer products, all sorts of materials. So no matter how old your home is, it's possible that it could contain asbestos, and it's important to have a survey done before you disturb any of those materials, do any renovations, repair any damaged materials. And you can't just look at materials to see whether or not they contain asbestos. You have to take a sample, send it to a lab, and then the lab will analyze it and tell you if it contains asbestos. So it could be in any of the building materials in your home. So really important to watch out for that.
VOCs, they are volatile organic compounds. They are chemicals. They are mainly found in our daily items. Could be paint, could be in new furniture, air fresheners. Especially it affects children and people with asthma.
Lead-containing paint in buildings is really important to look at, especially in buildings that were constructed before 1978, because in 1978, that's when the lead-based paint ban went into effect.
When old paint breaks down over time, it turns into toxic dust. Children can easily ingest it or breathe it in. It may affect their learning ability, their developing brains, and also their behavior.
Yeah, the best way to deal with it is to hire a contractor who specializes in lead abatement. Historically, overburdened, underserved communities are the ones that are really impacted the most by environmental contamination. If you live near an airport, you could see higher levels of fine particulate matter, and other gases from the plane exhaust that would kind of carpet your neighborhood area, so you could be exposed to that as well, along with the industrial sites or wildfire smoke that might be impacting your area.
Over the course of our lives, if we continue to be exposed to pollutants, that can have an effect that really builds up. And it's important to do everything we can to make sure that the air we breathe is clean.
Now that we have a better sense of how indoor air quality affects our health and sources that contribute to indoor air pollution, let's take a look at some of the things people can do to make their indoor air quality healthier. These are all actions that can easily be taught and demonstrated. Here we go. Use mechanical filtration, such as a HEPA air filtration unit, which can reduce up to 99% of the particles in the air. Generally, with a HEPA filter, you want a clean air delivery rate, or CADR, of 65% of the square footage of the room it's intended to be used in when used at its highest speed. This means you may need multiple units to achieve the right clean air delivery rate for a single room, and multiple HEPA filtration units are often necessary to filter the air for an entire home. In instances where more than one HEPA filtration unit is necessary, units should be distributed throughout the home and located in rooms people spend the most time in. Also, it's recommended to only use HEPA units that do not have additional technologies or features like ionization or oil diffusers, as they may cause unintended harm to people's health. Remove your shoes upon entry and place in a storage bin to avoid carrying in outdoor pollutants. When cooking using a stovetop or oven, use a kitchen exhaust fan or a range hood to help push bad air out. In homes without a kitchen exhaust fan, open windows when cooking to increase ventilation. Opening windows can usually help improve indoor air quality. A window fan can also help push bad air out and draw in fresh air. But before doing either of these actions, make sure to check the local air quality index to better inform whether to open your windows or leave them closed. Avoid the use of portable propane heaters indoors. Consider an electric heater if you need to heat a space. Portable propane heaters used without proper ventilation can result in the rapid buildup of carbon monoxide, which can be lethal. Use home and garden products that do not contain toxic chemicals. When shopping for household products, it's safer to read the label and choose the least hazardous products available. Look for the Green Seal Certified, EPA Safer Choice, or EPA Designed for the Environment logos on the product labels. If you park your car in a garage, open the garage door before starting the car. During wildfire smoke events or times when outdoor air quality is not good, keep windows closed and use a box fan filter or a portable HEPA air filter for cleaner air. If you have a garage or outdoor workspace, keep doors and windows open for any prolonged amount of use. Never operate portable energy generators or small engine appliances in an enclosed area and only use these outside. Cooking activities like grilling, barbecuing, smoking meats, and deep frying are better done outside in an open air environment. Keep paint, chemicals, and other household hazardous materials stored securely with tight-fitting lids. For adults who smoke, it's recommended to only smoke outside to keep the indoor air fresh and reduce the risk of second-hand smoke exposure for other building occupants. Finally, place tight-fitting lids on trash cans and compost to reduce odors. This is all very accessible information on indoor air quality, but it's just scratching the surface. If you'd like more information on the importance of indoor air quality, as well as more air quality tips available in multiple languages, visit kingcounty.gov/IAQ or check out our YouTube channel at KC Public Health. And thank you for helping our communities breathe better at home.